The topics covered in this video are factors looked for in an application, support information, NHS experience, and right resources to prepare for an interview.
Hello everyone, and welcome to this panel discussion. We from the JIPMER Alumni Association of the United Kingdom are proud to have this discussion. We have three senior consultants from the NHS here who have had lots of experience in being interviewers, and we are here to get some tips and tricks on how to excel in your NHS interviews. I am Azhar. I am a junior doctor who just joined as an SHO in Leicester, and I have my colleagues with me.
Yeah, my name is Gopika, and I'm currently doing clinical attachment in Queen's Hospital, Romford.
Hello, I'm Dr. Nikhil, and I'm a junior doctor who's doing a clinical attachment at Queen's Medical Centre, Nottingham.
Moving on to our panelists.
Good evening, my name is Pregash. I'm one of the consultants currently working in Manchester. I have just over 5 years of consultant experience, and I've been on the interview panel for junior doctors for the last 3 years.
Hi, I'm Caroline. I'm one of the consultants in Obstetrics and Gynaecology in Manchester, and I've been a consultant for 20 years and I've gained a lot of interview experience over that time, interviewing different grades and different categories.
Hi, I'm Clare McGettigan, and I'm consultant at Manchester Foundation Trust, where I've been for the last 11 years. And I've got experience at interviewing at many levels, and also lots of experience of having been interviewed in the NHS, which I think has been invaluable, and it will be invaluable to share with you.
First question. So a candidate gets shortlisted for an interview based on their application. So what are the things that you look for in an application?
So when we're shortlisting, there'll be a specific criteria that we look through. We have a standardised pro forma to keep it equal. So there'll be certain criteria from the foundation training programme within the UK, and there'll be certain criteria for international medical graduates for equivalency. We'll look for quality improvement projects, we'll look for taster experience within the specialty, and we'll look for extracurricular experiences, such as any extra degrees that people have had, and any extra interests that people have had, like senior membership of societies and leadership experience in particular, which will score extra points on the scoring form. All of these points will go towards shortlisting criteria. It will depend very much on the specialty, on the scoring criteria, and this information will be transparent and freely available from each specialty, so that it will be an equal playing field for everybody. Is there anything else that you want to add?
I think the other thing I'd add is the fact that that scoring system is based on the job description and the job specification, and it is absolutely vital that when you're applying for a job you read through that job spec, and where it says essential, make sure that you fulfil that criteria, and if you don't quite fit the criteria, make it clear on your application that you've got something that might sort of fit into that. And both on the essential and on the desirable areas as well. If you're applying for some specialty area where you've got some experience in a specialty, say a middle grade post, make it clear what your experience is in that post. So don't just say, I've done this job for 3 years in X hospital, because we don't know what experience you're gaining at that hospital, and we don't know at what level you're working at. So if I use an example for obstetrics and gynaecology, we'd be wanting to know, can you make decisions on labour ward? Can you do caesarean sections? Can you do assisted deliveries? And also things like for obs and gynae, there are specialty related things like looking at babies' heart traces that we would want to know that you can do. And you may think, well, that's barn door obvious because everyone in my unit can do it, but we don't know that looking at the CV. So all these sort of little extra things help. Simple things like making sure that we can see clearly your basic medical degree, making sure that if you've got an MD, that is clear as well, because that always scores you extra points, or you've got a PhD or an extra degree or a leadership degree or an education, qualification, those help. But simple things in your mandatory training like basic life support, and the last set of interviews I did, I was surprised that over half I couldn't give them 2 points because they didn't have their BLS, even though it was there on the essential criteria. And I'm sure most of them have done that, so don't sell yourself short. Thank you.
So adding to that, there are a lot of desirable criteria, especially if you're applying for surgical specialties. So especially in UK, you need to do adult trauma life support, which is an ATLS course, which again, will score you more points if you have done that course, or at least if you have booked yourself for the course. A lot of people may not have done the course, but some people, you could have booked yourself for the course, which actually shows a bit of commitment that, you are committed to a surgical specialty. So even if you have not done the course, say that, yeah, I've got this course coming in the next 3 months and I've already booked for the course. So that will add points. And then there are certain other courses for surgical specialties. For example, basic surgical skills course, which basically tests you on suturing and simple plastering techniques. So if you show that, then they will know that you are adept at suturing as well as plastering techniques. And again, at SHO level, if you say there is a course called care of the critically ill surgical patients course, CRISP course it is called. So again, if you say that you have done that course, then that implies to me that you are capable of handling patients with medical problems in a surgical ward. So that will score you high amongst the other candidates. So I think these are very essential. And as my colleague said, when you've done a middle grade job, or if you've done a postgraduate job, be specific to what competencies you have achieved. For example, like if it's a surgical specialty or an orthopedic specialty, for example, saying to a surgical specialty that I'm capable of doing appendicectomy and a minimal supervision will put you on a higher level than your colleagues. Same thing like if you are applying for orthopedics, saying that I can do straightforward procedures like hemiarthroplasty or a DHS fixation, again puts you on a higher level than with your colleagues. So don't feel shy and just say that, yeah, I worked for 1 year in orthopedics, without mentioning that what you have actually done. Say that. And the other most important thing which people will look for is, especially that when you're going as an SHO or a middle grade, you will be on call. So when you can say that, yeah, I've done on calls and I can take the on calls and I can make independent decisions with straightforward cases. So that will again, put you on a higher level with your peers, and that will increase your chance of getting shortlisted.
Thank you, my dear panelists, for going over that wonderful overview. My question is specifically about the supporting information section, which can be often confusing for applicants in terms of what is important. So would you say whether it's audits or teaching that needs to particularly stand out, or is there anything else that you think needs to stand out?
I think both are important. I think it's the quality of what the information that you provide. I think it's important to say that if you did an audit, not to say that you just performed an audit, what was the outcome of the audit and what was the change that happened as a result of the audit. I think sometimes that's the information that candidates leave off. And I think that's the most important thing. And if you were only a partial contribution to the audit, what was it that you learned from that contribution to the audit? Because you might have been the most junior member of the team, but you actually did the data collection for 500 cases, which was huge and an immense job, and took you the best part of 3 months to do. And what you learned from that, and what you would do differently next time in terms of how you were lumbered with that huge task, and that you think, well, actually, we should have done that prospectively, so that would have been a much easier task going forward. So it's about what your reflection of your learning was from your contribution to any project. And if it was a teaching project, what was your feedback from the teaching? How did the students receive your teaching? So that you can say, well, actually, I scored 5 out of 5 and everybody loved it. Or even if you didn't score 5 out of 5, what did you learn from it if you could have done better, and this is what I learned from it, and this is when I repeated the teaching session, or I did another teaching session, and then I scored better the next time when I did it. So it's about how you've used each and every one of those experiences to learn and improve and grow, because that's what we want to see about anybody that we're about to employ, is that you're not a static person, you're a person that's somebody we want to have as part of a team. That's as a doctor, we're always learning and growing. Every day is a school day. So that's the most important thing about anything that you present on your CV, that you're showing us something about you as a development tool.
I think the other thing that you can add, that area is also a space for your extracurricular activities, so that if you do a lot of musical things or a lot of sports, particularly through that you can demonstrate, or charitable work, if you can demonstrate some sort of leadership skills, organisational skills, team working, then that is something else to put in that, because those usually come in the desirable criteria, going back to the scoring that we mentioned before, but it also gives us an idea of how much of an all-round person that you are, because whilst there is a scoring system, we also want somebody who is going to be part of the team, who's keen to learn. So if you can demonstrate that in that section, then that's sort of my tip for that area, I think.
So my tip for the supporting section is that, as Caroline said, you need to highlight your extracurricular activities, as well, because it's a supporting session, is a free session, so where you can write a lot of other information. So, but the most important thing is that you need to tailor it for the job. For example, that is where you need to know about the job, what sort of a person they are looking for, and if you think that for example, if you have done a course, or you have done some a cadaveric surgical course or something like that, which specifically addresses your specification for the job, then I think it is essential that you highlight that for the job, so that you score brownie points. The one thing I would like to say is that please don't repeat whatever information you have already given in the other sessions. Yeah? I know a lot of people, what they do is that, when you say the supporting session, because recently I was on the panel, so essentially he has cut and pasted most of the information in the other sessions, so brief summary of 2-3 points from each one. So it is basically you are repeating whatever I've already said. So the moment you see that, you lose interest in that, and you think that should I be shortlisting this person at all. So please don't repeat it unless you want to elaborate. And try to write something which you have not written there because of word restrictions. So try to write anything extra which is relevant to the job, and that might highlight you as a person of choice amongst the interviewers.
So thank you for that. The next question that I wanted to ask is, do you think that having NHS experience is absolutely essential? How does that bit of the experience come into play?
Having just recently done some interviews for middle grades, of which a lot were international candidates. NHS Experience is one of the things that they actually had to tick the box for on the criteria list, but we still allowed them through. Even though they couldn't tick that box. So it's still worth applying for the job, even if you can't meet all the essential criteria. In terms of NHS Experience, yes, it is viewed very, very favourably, and any experience that you can get is very helpful. And we know there are issues with visas and being able to work. But if you can get sort of clinical attachments and just get a feel, either a sort of general area, or if you're particularly looking for a specialist post, to get some, and Claire mentioned the taster sessions before, but taster sessions or clinical attachments, then it really does help, because one, it shows your enthusiasm to come to the UK and work, but it also shows that you have some experience. And there's always the feeling that the NHS is completely different to other units, which may or may not be different, but if you can show that you've experienced that, it also gives you something to talk about in your extra section on the CV, and it also gives you something to expand on during the interview.
So adding on that note, so please don't be put off if you don't have an NHS experience. Having NHS experience is absolutely vital, and it is often used as essential criteria. But saying that, the recent interview that I had attended and where I was on the panel, there were excellent candidates who did not have NHS experience. A couple of them were working in the Middle East, and their experience was so good that they actually got selected over the NHS candidates, because we didn't feel the NHS candidates, in spite of already having NHS experience, we didn't feel they had the adequate competencies that we wanted for the job. So please don't be put off by the fact that you don't have NHS experience. It's not always the case. Having NHS experience is always a bonus, but if there is essential criteria, please don't be put off that I wouldn't apply for the job because there's no NHS experience, because on that day you never know. Amongst the candidates who have been shortlisted and interviewed, you might score better even if you're not an NHS experience. So please don't be put off by the absence of NHS experience.
So thank you for the wonderful insight on what you look for in an interview. So my next question is, what are the right resources to prepare for an interview?
It's a really difficult question. There's so many resources out there. I mean, I think you'll have probably exhausted a lot of them online. There's so many books, there's so many courses online. I think you can probably find so many courses there. I think it's just finding upon a particular resource that suits you and then working with it. I think your main resource is yourself. I think self-knowledge is the best one for preparing for your interview. I always tell people that preparing for the interview is like doing an A-level into yourself, and if you can show your experience with your answers, then that is really the best thing. A lot of people talk for a long time on interview answers and describe things, but they haven't actually showed us what they've done that's relevant to the particular post that they've applied for. You'll probably hear about the STAR format quite a lot when it comes to interview preparation, and the reason for that is it's about showing what people have done, so it's like, what was the situation, what was the task involved, what was the action, and what was the result. And I can't really say that often enough, and that's the biggest thing about going through everything that you've done and thinking, how can this apply to the standard types of interview questions? There's masses of interview question lists on the internet, and going through all of them and thinking about your own experiences in all of the specific areas, and preparing in good time and getting your friends and family to ask you those questions at inopportune moments so that you're really getting to think on your feet.
There are some courses available online, but you need to pay for them. So it's called ISC medical courses. They give you interview preparation for junior grades as well as senior grades, and in fact they run a regular course for the consultants interviews. They have got very good resources, so if you can afford to pay and attend these courses, so they'll give you a booklet where your common questions should be answered. Again, you can always get these questions online as well. Online is actually a very good source of information where you can pretty much get a lot of questions, and then you can prepare for them. So these would be some of the resources.
The other thing I'd just add is read through again the job description first of all, because part of the preparation is knowing the job that you've actually applied for. And if you've applied for 5 or 6 jobs at the same time, and you may have applied for a surgical job, one and a medical job, or you may have applied for one in a sort of small district general hospital, and you might have applied for another one in a teaching hospital, they're going to be looking for slightly different things. And there's nothing worse at an interview than being put on your back foot because you've answered the question about, say, a surgical question, whereas actually the jobs are medical, and they're sort of sitting, and you know, that's going to be really difficult. So just make sure you know just before the interview what type of job it is that you're going for and what they are looking for in the job, so that you can show yourself to the best of your capabilities and your abilities.
And I think adding to that, I think knowing about the local unit. So I think that trying to speak to somebody from the local unit before you go for your interview is invaluable. So that's not about canvassing, it's about trying to speak to, you know, if it is possible to have a pre-interview visit, speaking to people about what the job is actually like, so that you know what the demands of the job are, what the best bits about the job, what the job requirements are, so you really understand what the needs of the job are, what they're looking for, and that will come across in the interview, that you've done your research and your due diligence, so that you are meeting, as Caroline has said, the job specification. You want to meet the essential criteria easily, and you want to shine at the desirable criteria, and to show yourself to be that team player that's going to really thrive in the unit. So that's how you're going to succeed at the